Well, as cases rise in New South Wales, there are concerns the hospital system will be under significant pressure. Joining me now live is Dr. Anthony Holley from the Australian and New Zealand Intensive Care Society. Doctor, good morning. Thank you so much for joining us. Firstly, can the hospital system cope with the rise of cases?
Morning, Danica. Look, this is an incredibly challenging time and it's a concerning time. But what I can say is that the intensive care community has worked incredibly hard over the last 2 years to prepare for what was inevitable, the opening up of the nation and the increase in cases. And it's in this construct that we've had a lot of preparation put in place to ensure we're best prepared. That said, there's a lot of unknowns, and the intensive care is in fact a finite resource, and so we just have to carefully manage it and continue to encourage vaccination and moving into the booster program, which I think will be useful, and utilise all of the strategies we've put in place in order to deliver the best possible critical care for Australians.
When we look at the ICU rate in New South Wales, for example, 45 people in ICU today. It's up 5, I believe, from yesterday. That appears to be a steady figure. What can the ICU system handle?
So look, as far back as March of last year, the Australian New Zealand Intensive Care Society in collaboration with Ambulance Victoria was able to develop a system that gives us total visibility of ICU beds across the nation. And I can tell you as of today, there's over 2,000 intensive care beds that are fully staffed. And across the nation, we have 165 patients in ICU. Now, what that would suggest is that there remains some capability and room to move. But it's a dynamic process and we have to watch very closely as the numbers edge up. There's inevitably a delay from recognition of infections until patients potentially require critical care. And it's that delay, which probably around 8 to 10 days, will give us slightly better visibility. But to answer your question, I think we're well prepared. We still have capability, Danica, at this stage.
We're seeing a rise in cases today, over 5,000 in New South Wales. During the Delta outbreak, cases sat at around 1,700 at one point, but ICU and hospital figures were much higher than they are now. Why are ICU cases now a lower percentage of the COVID cases than they have been previously?
Yeah, I think it's a very interesting question, and certainly I would suspect it's to do with the number of vaccinated individuals. What we do know about the vaccine is that not only does it prevent infection in some individuals, decrease transmissibility, but probably most importantly, it decreases the risk of severe illness. And that is probably exactly what we're seeing in terms of slightly lower numbers in ICU. But I'd caution, Danica, that we need to still watch and see how things see how things evolve over the coming days.
What does it take for a COVID patient to be deemed in need of ICU care?
So look, again, this is an area that's been very well looked at. In fact, many of your viewers may be aware of the National COVID-19 Clinical Evidence Task Force. And this is a body that's been established to look at precisely what are the best treatments available, what are the issues surrounding COVID and how best to treat them. And in that setting, patients are staged according to mild, moderate, severe or critical illness. And the kind of things we use is respiratory rate, saturations, pulse oximetry to look at oxygen levels in the patient's blood, and indeed blood pressure and other organ systems. So there's a very solid way of determining if somebody's critically unwell and indeed in need of intensive care.
Dr. Anthony Holley, we have to leave it there. Thank you so much for joining us this morning. Appreciate your time.
Thanks very much, Danica. Happy Christmas to you. Bye-bye now.
Thank you.